Welcome to the office.
So 2004, what did you do?
I was an electrician, and
Okay.
I remember I was pulling cable
Okay.
wiring. So next day or the same day, I couldn't sleep from pain,
Okay.
and I start not be able to work because of heavy stuff on me.
Okay.
And
So you got the belt, you got a lot of equipment,
everything.
and then you were doing something that.
But it started with me exactly 6 months before, and I was just there's a cable on the ground. I was going to grab the cable,
Okay.
and I sit on the floor. I couldn't. That was the first time in 2003.
2003.
But I didn't keep it in my mind. It was like one time, and that's it. And no pain after that.
So you went down, you were picking up a cable at work.
Every time I feel it's like somebody's holding three nerve and switching.
I got it. Okay.
That's how
So that was the first time. Then nothing. You were good. What did you do?
I was in Saudi Arabia. I
Okay.
stay bed and just relaxing for 1 week. It takes me a long time. After that, I came here. I start working, and the problem start again. And it was daily basis.
So since 2004, you've been dealing. We're 14 years, guy.
And taking tons of oxycodone, of all this
A lot
kind
of pain meds.
Yeah, because nobody told. All of them, they told me there's no surgery.
Okay.
I sent my file to Paris, to American University of Beirut, to Texas, to New York. A lot of professors, they see to Cedar Sinai,
Okay.
and all of them, they told me there's no surgery for you, there's nothing you can do.
So why are you walking like this?
Because
What were you told?
They told me you have to keep continuing your life with this kind of pain, and nobody can do any surgery for you because if you
Since 2004,
until now.
they told you there's no solution but pain management. Okay, I got it.
And or I keep taking medication.
Okay.
But when I'm on the floor, I'm on the floor.
Okay. And when was your last episode?
Last episode was on Wednesday. Last Wednesday.
Last week.
Yeah.
And what happened? You just.
I have my foot on the ottoman. I'm just moving the ottoman, and I fell on.
Before that, he sneezed.
Well, one time before that, I sneezed, and my father-in-law hold me. So because one time I was working in a parking lot,
Excuse me.
and I fell down. The car's going back. I couldn't stop. My leg. Well, muscles wise, I did the test of the muscles. I have nothing, no problem with the nerves, nothing muscles, nothing.
So you have muscle strength. You have no loss of muscle power.
Because of my back, not of my leg.
Okay.
I can use the muscles of my knees, but when it comes
You
to
are
my hip,
able to use it.
my knees never
Yes.
stop.
Ankles.
Ankle never stop.
Everything is in the hips.
Everything from here,
The thighs.
the thighs going all the way, and
To where?
on the normal pain, always here. When I sleep,
So this section here, from here to here.
Exactly.
Okay, but it doesn't go past your knee.
Yeah, it does. Yesterday, I have a shooting, but it's not every time different thing.
But the shooting goes past the knee or no?
No,
Okay.
stop here.
And
It
did
used to be before, and I don't.
it
see
stops here?
from the back.
But it doesn't go now into your toes?
No.
Okay, so you're already
Just-
giving us half the answer, okay?
Okay,
This is the good news.
that's it.
Okay, so now you've seen multiple people, multiple opinions,
I did the discogram test.
okay?
It's one of the most painful surgery
Sure, they're
tests. I did the joint
That's
shot,
my L1 shot.
SI joint shot. I did.
You've done cortisone shots?
I did 5 of them.
Five
Five
cortisone
cortisone
shots.
shots.
Now, we were taught you don't do more than 3. After 3, it starts to demineralize bone. So we need to address that as well and see. And I'll take a look at that for you, and there are some things we can do nutritionally. It's very simple.
And they did the spinal cord stimulating for me, and that was the worst thing I ever did in my life.
So,
When
you're-
they pull the wire, they pull my spirit with it.
So you've been through enough, okay? You're here now. I appreciate you coming out here.
Thank you.
I know it's a long drive.
Thank you.
Let's figure out what we need to do. Watch you walk, please.
Sure.
Do you need assistance to walk?
No, with this pain, I love it.
Come on up.
Um,
And this is typical for him, right?
While I'm in pain, yes.
When you're in pain. Okay, can you walk a little bit back and forth, please?
Mhm.
Now, as you're walking, is it more pain when you step on your right heel or your left heel?
Today on my right, yesterday on my left.
Okay, come towards me, please.
Yeah.
So it switches from side to side.
Yeah, sometimes I walk like this, sometimes I switch.
So he's not the term is called antalgia, meaning you lean away from pain.
Yeah.
But for like right now, you're leaning
I'm
this
leaning
way.
this way. Yeah, I cannot.
But sometimes it goes the other way.
Yeah.
Okay, keep
And
walking.
one time when I had the kidney stone, both way are out, and I couldn't walk like a washer maybe. I couldn't walk. 10 feet I cannot walk myself.
Do you get any numbness in your feet, tingle? Just shooting pain.
Shooting pain.
No numbness,
No
no
numbness.
tingling. You can go to the bathroom, okay?
Of course not okay with the pain.
With
But,
pain, but
yeah.
you can go.
I can go, yes.
There's no bowel incontinence or
But if I have, that's the only thing I notice. If I have constipation,
Yeah.
and I use the restroom, for example, let's say 2-day constipation, and I use the restroom, my pain go down.
Got it, okay. Can you walk some more, please?
Sure.
So he's antalgic to the right at the moment. And you said when you're stepping with your right foot down?
Right now, the right foot, but I'm leaning this way.
That's what doesn't make sense.
Yeah, and the pain is here.
But you're leaning away
The
from
pain is here.
You're leaning
yeah.
into the pain.
Exactly.
Why?
But if I straight shooting pain, I will start from here as well.
Aha, okay.
Yeah.
Got it. Come over here,
So I don't
please.
know. Sometimes I'm telling you, I don't know where I'm gonna go.
Okay.
Because I feel like circle of fires going around my waist. That's the right word to say.
Okay. Have a seat over here. Let's not waste time then, and
Yeah.
let's figure it out, okay? And the first thing I need to do is just visualize what's going on.
Mhm.
It's not too hot down here, so he's not it's not an acute, he's not inflamed in terms of the muscles and tissues around.
Sometimes I feel it from here.
But here's the first thing I want us to see, the dimples. They're completely different. So the pelvis is off here. You can see this one is higher, this one is lower. This one has more swelling though, compared to this. The question is it the sacrum? Now, you brought your MRI, we're looking at it. It says multiple herniations here. But multiple herniations, how do multiple herniations happen? He had to have multiple injuries, if it's true, okay? Now, if I push here versus there, that's the sacrum. So this is the sacrum, okay?
Mhm.
Now, this is 5. Is that tender when I push? Pain?
Pain maybe from your finger, not pain.
Nothing shooting, right?
Not shooting. Yeah.
Right there.
Yeah. Kind of. Oh yeah.
Now come back slowly, watch.
Mhm.
Right there. That's S2.
And it's not all the way. That's not everything.
Okay, sit up. Now, as I said, there's gonna be 2 components here we need to figure out, right? Is the foundation, but also we need to check up top. Because a lot of times, sometimes if the messages aren't coming from the top down, then what happens? It's not going down. And the reason I'm explaining this, I was this patient 6 years ago. I had right shooting pain. I couldn't work for a month and a half. Tried everything. No one could figure me out. I had to go see one of my mentors in a different state. He found a 3rd cervical. He adjusted this only for a week. I still had pain. He goes, first you fix this, then you fix this. And after that happened, I got 50 cases like that. C3, all coming from here. I'm not saying it
Oh,
is
yeah,
or it
yeah.
isn't, but who knows? Okay, just
And I have
because.
bad migraine, by the way.
What's that?
Bad
I have
migraine.
severe migraines.
What other symptoms do you have?
Acid reflux.
Acid reflux. What else?
Just a chronic cough in the morning. It's from the acid
Okay.
reflux. That's it.
So the main reason you're here is for this low back. Some other symptoms that you're experiencing are acid reflux and
Yeah,
migraine.
just mention it, just to let you know. No problem.
Okay. And you'll let us know. We're not treating those symptoms,
Yeah, yeah,
but you'll let us know what
yeah. Yeah, I'm
happens
just
along the way.
mentioning. Yeah, yeah.
Okay. Let's go ahead and run the meter on your spine.
Mm-hmm.
I gotta be careful what I say, guys. Come here.
Where is the meter being? Toward the right or left?
Left side, almost 15 to 20 points around C2, C3. You see that, madam?
Wow.
Right
Oh,
there.
wow.
So there's a big reading up top here in the neck, sir. Is it hurt to sit right now?
No.
Okay. Now watch this. Look how the needle sticks all the way down. Do you see that, madam?
Yes, I do.
Can you tell your husband?
It's at, it stays all the way to 10
This
to
is
15.
this is cord pressure, upper cervical. I've explained this in,
Yes.
in the videos
Yes,
as
you
well. It's all starting up here. So I'm not gonna get anything here until I fix this. Okay, so we're gonna focus right now here. Okay, sir? We're gonna get this sorted out and then I'm gonna check everything. Now,
Okay.
scoot forward, please. And open and close your knees, please. Open wide and close. There you go. Do the right side only. Do the right knee only. Do the left side. Left side only. They're both stuck. Do the right side. Okay. Do the right side. Do the left side. It's up there and there's 2. This is 7, 6, 5, 4. That's 3. That's 2. Head down. Turn left. Turn right. Look straight. Look up. Turn left. Turn right. Look down. 7, 6, 5. 3. 2, 1. Okay. Let's go ahead and motion the head up, left. What I'm motioning here is the occiput, the skull. Okay, this is moving fine. It's a little tight on that left side. So what I'm finding here is actually starting at his 3rd cervical, C3, right there. Okay, that's what I'm finding. Now, I'm just feeling this to feel, because I'm going to check after I do the upper cervical, okay?
Yeah.
And we're going to see what changes just from the top.
Mhm.
Let's go ahead and check this a little closer. Sit back for me, please. Now, I'm going to dig in a little bit more than normal, okay? Just to... Good. Okay. Do one thing. I'm going to just put my finger here. Stand up for me, please. Stand up and sit down. Okay. Stand up and sit down. Let's go ahead and set your 3rd cervical first. Feet together, right in front. Put your right hand up. down. There. That's perfect. There we go. Come up slowly, please. Okay?
Mhm.
And now just walk. And the purpose of that is now we gotta rescope and make sure. Now let's see what actually shows up, okay? So now, let's see what happened. It's different now, right?
Yeah.
Okay, now let's see what we find. There it is. Now we can find it. It's down low, sir. 5 is here. Okay? It's not 5. It's down low, dude. Right there. Now when I push, tell me if it's different. There versus there. Right there. That's the one. That's the same.
Okay.
Okay?
Can you press, please, if you don't mind, on the one lower?
Okay. This is S3.
This one, the one on the lower, it's more hitting the right side. I feel the pain more.
Okay.
And the one on the top, it's leaning to the left.
Okay, good. No,
I
this
guess
is-
that's how I feel it. I don't know
That's
if I'm
okay.
saying something right or not.
You are. Okay, so let's go back to 5. 5 is an issue, but it's not starting at 5. Let's go to 1. S1. Okay, let's go to S2. Okay, let's go to S3. Where is it starting?
No,
sir?
two should
S2.
two stronger pain than S3.
Okay, so we need to start on S2. That's what I wanted to show you, okay? It's starting in the sacrum. It's not starting in L5. Okay. Now, you said it's easier for you go to the right side, it feels a little easier for you, right? Go to the left side now?
No, both sides.
You're okay, right?
Both sides
Okay.
on fire. Don't worry about it.
Then let's go on the side here.
Okay.
Put your head here, please.
All right.
I just want to get him in position, make sure he's as comfortable as he can be considering what's going on here. There we go. I got you, dude. You just let it go, okay? Look, I roll you, you go into my knee.
All right.
Nothing's gonna happen,
All right.
okay?
All right.
Excellent. I'm gonna do it as an S2, push, pull. Go ahead and just hold your wrist there, please. Let me push your shoulder up. Are you okay with that? Good. We're gonna do this 2 parts. First part is to get that S2 set here, and then the second part is gonna be, there it is, good. Gotcha. Gotcha. Second part is gonna be on the other table. Now, here's what I want you to do. Push yourself up. Take your arm, push up. Now, before you stand, I want you to sit right here and just do this.
Blood circulation.
Now, use your knees and push up. And let's walk. And just keep walking, please. Keep your head up. Focus on his feet. Good. And just keep walking, please. You got up a little bit easier. A little bit. walk about 3 or 4 more times back and forth, and then I want to recheck and continue. Now, it's not to say the other stuff isn't there, right?
Which one?
But 4 and 5.
Yeah.
But it's not starting there.
It's not starting.
We have to stabilize first the pelvis and the sacrum. Okay. Keep walking.
Now, as I'm walking right now,
Yeah.
exactly, the pain is walking with me, this point and this point.
Those are hips.
Well, that's why they did the X joint shot, because they told me it's the hip. When I did the X joints, nothing.
Keep going. Now, as you're walking right now, what's different? Good or bad, it doesn't matter, but what's different? No change yet?
No change.
No problem. Come on back over here and have a seat.
Okay, the dimples are gone. It's not swollen anymore.
It's less swollen, right?
Oh, yeah.
Okay, let's get through this. Head down, head down. Still about 5 points. Clearer there. Now let's see what happened here. Okay, now we're going to go on the orange table, okay? And either you're going to love me or hate me after this.
No, wait, I love you.
No, not yet. Okay, let's go back. S2. S1. Tell me. S2. S1.
Can I tell you where's my pain going?
L5. Now. Tell me. Tell me.
There's a nerve not on the 5. When I'm moving, nerve shooting.
When I push 5?
No, before 5.
That's 1.
The 2, I guess. Yeah.
Okay, let's go on the orange table now, sir. Right there.
All right.
Okay. There you go. Head down, please. Good. I'm just going to pump it a few times just to prep it. Can you handle this here? Is anything shooting down your leg when I do this? Gotcha. That's it. Done. Gotcha. That's what we need. Okay, sir.
I'm breathing. As long as I'm breathing, I'm good.
That was a home run, dude.
Trust me, for him it was.
That was
It was a
home
big
run.
step for him. Yeah.
You heard that? You felt that one, right? Take your time. Give me your hand. Look up. Step to the side. And walk. You gotta walk it off now. Keep your head up, please. Look straight at me. Look straight.
Yeah.
Don't look down. Beautiful.
Straight.
You're straighter.
I can feel.
Walk.
Yeah.
There you walk. I had to go for it. Look, he's getting better as he goes.
No, I'm telling you right away. I can feel it.
Keep walking.
But the only thing is the pain from.
That?
When something now it's loose. Before it's not.
Why are the ladies laughing at you? Your wife is laughing. Why is she laughing at
Well,
you?
let her laugh.
Let her
she's,
laugh.
she's being suffering since 2004. so at least if she can laugh, let her
Get a
laugh.
smile from her, dude. Now you're gonna see each time is gonna get less. You walk now.
She can laugh, let her laugh. She can trust me.
I'm sure. And your children. You're gonna be okay. You're walking smoother now. Now here's the thing we need to understand also. You look at this as you had this big rock on your foot. I gotta get the rock off the foot, and now it can heal. Does that make sense?
Yeah.
But it was misleading. You had a lot going on up here first. Now when you get your, we're working off those MRIs, that's what we did, you'll get your full spine, and we gotta do the pelvic analysis, and then we'll do the analysis and figure out what do we need to do to fix this, okay, the best we can. And we need to look at the condition of the disc. You
I
keep
want to
walking.
mention something. For the past 15 years, not one person said it might be from your neck.
Say that again?
No,
No,
in the past 15 years,
even
nobody's
pelvis.
ever said his neck.
But no, but that's not a common thing, so you can't, I don't wanna say anything against anybody else, and the only reason I know this, I was the patient.
Yeah.
And it was one of my mentors, been doing this 40 years. Sit and stand a few times now, it should be easy. You see how he's moving now?
Oh yeah, no doubt.
Stand up, right away. It's not 100%.
No. Totally understand.
Have a seat. Push off your knees. Now walk.
Just try something.
Oh, wow.
Yeah, now it's quiet.
It's in the middle, yeah.
Yeah, it's quiet now. Now watch this. Let's see. Back slowly. I know.
It's more flexible,
Yes.
and I
but
can
it's
feel it.
tender.
I can feel the joint.
Yes.
I
you
guess
can also
because
see.
before you were pressuring on one piece.
Yes.
Now I can feel that there is two
Moving.
pieces.
It's moving. So here's S2. Okay. Here's S1. And here's L5.
Yeah.
It's still going to be a little tender. That's where we're going to start. Okay.
Okay.
So what you do is you go get those films.
Alright.
I don't want to mess around with too much other stuff right
Yeah,
now.
totally.
And I need you icing. What I would do also is, let's go
It
get.
has to be ice, better than heat.
Heat will make it worse.
Oh.
You never, if there's inflammation in the disc,
Uh-huh.
you don't put heat.
Always
You put
is.
ice. 15-20 minutes on, wait 1 hour, do it again. You can do that several times. Put a t-shirt or something on the ice pack so you don't get freezer burn. Stand up, I want to check something else, please. Put your hands on top of mine. Raise your right leg. Look at me, please. How's the back pain? How's the back pain?
No, but
Other leg. Okay. Is it hurting where you're lifting?
it's hurting on it's going shooting
Okay.
left and up, but the right one,
So
which is
it's a good test